then number 4, you're going to accurately palpate the appropriate bony landmarks on a skeleton and on a subject. So I'll say to you, or Chase will say to you, all right, what are you going to use to line up the axis of your goniometer? And you're going to say?
Greater tubercle.
Greater tubercle of the humerus, I'm going to say. Okay, palpate that over here. So you'll come palpate that on the skeleton. What are you going to use to line up the proximal non-moving arm of your goniometer? So mid-axillary line of her body, a line that goes right through her axilla down her trunk. All right, and so that's not a bony landmark, so you don't have to palpate that. And what am I going to line up the distal or movable arm of the goniometer with? Okay, so lateral epicondyle, I'll ask you to come palpate that on the skeleton, and then show me on the patient, lateral epicondyle. I'm going to see you we're going to see you actually make those palpations. All right. And then number 5 is accurately align the goniometer, and you're going to have the patient attempt active range of motion. Number 7, you're going to measure both active and passive if there's a significant difference. All right, for this skills test, active and passive is going to be the same thing. All right, so just think about you're measuring active range of motion. So, okay, so I found my landmarks. Greater tubercle. All right. Okay. All right. Can you do that motion for me, please? As far as you can. And as far as you're able to go. All right. And I got a 97 there. That's about 95, right? So I'll just write down 95.
No.
Right. 97. Write down 97. Okay. So that's number 8. Read and record the correct goniometric measurements. All right, what if I looked at it and I got 82 degrees? So I'm looking at it, that looks like it's more than 90. Why am I getting 82 degrees? I'm reading the wrong end. Again, that's why we do the visual estimation at first. Make sure I'm reading the right end of the goniometer. Okay, so number 8, read and record the correct goniometric measurements. All right, the way that's going to work is I'm going to have this piece of paper somewhere close by you. You can see there's room for all the shoulder joint movements. So I'll say, go ahead and record what you got. So you'll walk over and you'll find shoulder flexion, and you'll write out goniometric measurement right there. Okay, so how are you going to write that out? All I'm looking for here is 0 degrees to 97 degrees. We've got shoulder flexion written. So 0 to 97 degrees.
We don't have to specify right or left.
No, you're going to do that in the note that you're going to write.
Okay.
So right here, I just want to know the goniometric measurements. So 0 to 97 degrees. And then you're going to, number 9, accurately document your goniometric measurements on a documentation sheet. And I'll show you that in just a minute. What you're going to do is I'm going to give you this piece of paper, or Chase is going to give it to you when you're done. And on the back of it, you're going to do your little quasi-soap note. So that's what number 9 is talking about. And when we're done, I'll show you what I'm looking for with documentation. But on this sheet, I'm just saying that you got what your measurements were, what your goniometric measurements were. And then you'll do quasi-soap note on the back after you finish the skills test. Look at number 10. We're also looking at your body mechanics. Right? So the tables go up and down. You can squat, you can sit in chairs, but we are looking, there are points for body mechanics. All right, so you have a total, notice, on page 162, you have a total of 10 points for each of the measurements that you do. 10 possible points, and we'll make deductions if there are errors in the paper. Okay, notice number 11, the automatic pass-fail, and this does happen at the shoulder joint. And the most common time people fail this is your assignment will be to measure shoulder flexion, and people will do this measurement right here, which is shoulder abduction. Okay, and again, I think I've mentioned this to you before. I've seen students also freeze up because they're supposed to measure shoulder abduction, and they're trying to figure out how they're going to do that. And I've just seen students just freeze up and can't figure out what to do here. What's the problem?
Turn it.
The goniometer needs to be in the same plane as the plane of movement. So I've also seen it like this, measuring shoulder flexion, and the person is figuring out. I feel bad. It's just so simple. So what helps avoid that sort of thing happening on the skills test?
Practice.
Practicing, right. Because there's no surprises. You know exactly what you're going to be tested on. Okay, so any questions about the goniometry part of the skills test? While we're here, let me think about the exam now. The written exam will have goniometry questions. That might be a little bit more challenging. Can I get you sitting up on the side? Actually, I'll do that when I get to muscle testing. So let's look at the muscle testing part. So you have 2 goniometric measurements you're going to do, and you have 2 manual muscle tests that you're going to do. One of them will be a shoulder muscle. One of them will be a shoulder girdle muscle. And I know I have blanks for 2 shoulder muscles and 2 shoulder girdle muscles. That's because in the ideal world, I'd want you to do that many muscle tests. But we just have time for 1 shoulder and 1 shoulder girdle muscle test. Okay, so same thing is going to work. The patient is going to be told what weakness they're going to simulate. So, Deborah, let's have you be right shoulder lateral rotators tested. I want you to be a grade 2- over 5. All right, so the patient panics. She remembers what a 2- is. And we'll see if she gets that right or not. Oh, by the way, look down on the bottom of your sheet. No consultation. Just relax and do your best. Go for it. But do notice patient simulation, 10 points. All right, so if you make an error as a patient, either with your range of motion or the muscle grade that you simulate, points will be deducted from that. So not to put pressure on you or anything, but you want to realize that. You want to be as accurate as possible as a patient. All right, let's look at the criteria for the muscle test. So number 1, give appropriate explanations and instructions. That's typically more challenging with muscle testing. I'm going to listen to what you're saying, see if it's clear, if it's accurate, if it makes sense for a patient. Number 2, position and stabilize the patient appropriately. So if I'm going to test lateral rotators, ideally, what position do I want the patient in?
Supine? No, prone.
Which is it, supine or prone? Prone. It is prone. All right, can I get you lying on your stomach with your head down at that side? And Kyle, can you run and get a towel for me, please? Okay, so number 2 is position and stabilize the patient appropriately. Okay, so stabilization. Again, what's the proximal bone for the shoulder lateral rotators? Scapula right there. So again, the weight of her body is doing a good job of stabilizing. And can I get you to scoot to your left just a little bit, not much, just a little bit. Thank you very much. Oh, this is one of those big towels. And just to get her humerus horizontal. Okay. Okay. Determine, very important, number 3, determine the patient's available passive range of motion. Okay, so, and there's 2 reasons I'm doing that, right? First one is just what it says. I'm saying I'm going to Just relax, and I'm gonna want you to lift your hand up